Ozone treatments is a very conservative way of treating many medical problems and many dental problems. Ozone is not a drug, it's a natural form of oxygen. And because of that, there's no toxicity to it, there's no overdose of it, and it's perfectly safe. Think about it. What's the two most important things in life? It's oxygen and water. And you know what the byproducts of ozone is? Oxygen and water. Most of the time, our dental problems that we're treating are infectious in nature. It's the microorganisms that cause tooth decay. It's the microorganisms that cause death of the tooth where you need a root canal. It's microorganisms that cause gum disease and gum infections and cause tooth loss and that. And ozone kills them all. Ozone treatments here that we use on a regular basis is, first of all, we keep our water lines pristine clean with ozone. We can use ozone on a daily basis for extractions. When you ozonate or sulfate ozone in an extracted socket, it will almost immediately stop the bleeding. It also kills all the bacteria down the socket, and you have very few post-op problems like dry sockets and infections and post-op pain for days or even weeks after extraction. So ozone's pretty much near eliminated that. We also use ozone in the treatment of gum disease, where we'll actually sulfate the pockets with ozone to kill the bacteria down in the pockets.